Hi there, my name is Dolopo and I'm a licensed acupuncturist. And today I'm going to be discussing another fertility case. We're specifically going to be talking about miscarriage. This is not a topic that I like to talk about. This is a topic that I've avoided over 21 years. I've done 14 fertility videos so far, I believe. 13 or 14. The last one I just posted last week on intimacy and fertility, also known as Taoist bump and grind advice. So it was very informative. It's 33 minutes and my patients got a lot from it. The first 9 videos are on natural fertility. The 10th one is Anne's 30 pieces of advice for fertility. The 11th video is the introduction video I give now to patients to make sure they're screened before they come in, to let them know this is what my philosophy and methodology are, and make sure we're on the same alignment. And then the 13th video, the 12th video is on IUI, IVF, and the 13th one is on the intimacy and fertility. The people who told me about Chrissy Teigen and John Legend's unfortunate miscarriage were men. And at first my husband brought it up. This is a conversation I have almost daily here with new patients. So this is a daily thing for me. And so I didn't really, think much of it. It's sad, but it wasn't something that I was going to bring up and make a video on. But then at midnight, a friend of mine, a guy friend, just out of the blue, he doesn't normally text me, especially at that late. He just texted me the news clip with Chrissy Teigen and John Legend's story. And I actually watched it. I don't pay attention to the news. I don't really go on media much. I am inundated with my own work and my own family and my kids and my own doctorate and my own things that I love to do. So I don't really pay attention to the news. But I took a moment to watch it because someone sent it to me. And my husband had said, maybe you might want to discuss miscarriage. And I said, yeah, maybe one day. But within a few hours, I got this text from a guy to say he wanted me to, use it in my practice. And earlier this week, my other patient told me about how ever since his wife had a miscarriage, at least 5+ years ago, they've never been intimate since then. They barely kiss. Maybe they hold hands, they don't hug. And he's not going to leave her, but this was his story. And I get a lot of these types of stories. Men feel very comfortable with me as their practitioner to share their stories. Men are very solution-based. And the thing with acupuncture is we're very solution-based. We will get your period perfect. We will make sure that you are the perfect baby palace. Chinese medicine, which includes acupuncture and herbs and qigong and the proper mindset. And I discussed in my last video, the Tao of love and sex, proper mechanics when it comes to sexual activities. I'll let you watch that video. This is more serious. It's not as funny. This is about a miscarriage. And this is all my opinion and also based on material that's been passed on to me from classical Chinese medical texts and modern Chinese medical texts. When we truly believe in Chinese medicine, but especially my own experience, if we can strengthen your kidney, qi, yin, yang, jing, your chances of a miscarriage becomes very low. That's my opinion. 1999 to 2006, I took all fertility cases among whatever other health issues. And my success rate was almost equal to my failure rate. And the losses were very impactful on me and not in a good way, to the point where I left and I stopped treating fertility cases in 2007. And I swore to myself I wasn't going to take any more fertility cases. It was too much. It was too emotional. And I just didn't see the benefits of Chinese medicine and my ability to stay sane at the same time when it came to fertility. But what I did was I focused on patients for autoimmune issues, pain issues, mental health issues, musculoskeletal pain, cardiovascular, digestive, all kinds of internal health issues. And guess what I found in 2007? I started seeing that when people went to the root of the problem, things were happening, powerful things were happening. That was my 8th year in practice, and I started seeing magic happen. I started seeing how people really healed if they took the time to really go to the root of their health issues. So then it occurred to me, if I can reinvent myself, which I did in 2008 when it came to fertility, that I would, if I focus only on natural fertility, I can really address with these women the root of their health issues so that they can get pregnant. And guess what? My success rate started soaring. 2007, when I didn't take any fertility cases, that was probably the most peaceful time of my entire 21-year practice so far, because I didn't have the emotional baggage of women coming in and wanting something so desperate, but being so much in a rush. But in 2008, when I started focusing on natural fertility and going to the root of the problem, it started really making sense. And I started formulating systems, 6 to 12 cycles, 12 to 18 cycles, 2 to 3 years, to make sure women became perfect baby palaces. Unfortunately, last year, my colleague in a different practice was diagnosed with cancer. So he sent 90+% of his practice to me. And these included women wanting IUI and IVF. And these were patients that I referred out for 11 years. I didn't want anything to do with IUI or IVF. I wanted only natural fertility cases. So now I was in this paradox. I was in this situation where I'm dealing with patients who I actively turned away, and it pretty much swallowed up my practice. I had to learn how to manage my own patients and tell them to start scheduling away in advance, because these other patients from the other doctor were scheduling 3 to 6 months in advance. I went from focusing on going to the root of the problem to get me pregnant now, which was the exact opposite of my philosophy and my methodology. So what I've noticed over the past year, it's been since July 2019, it is now October 2020, I have found and I formulated a system for patients to come 3 times a week if it's 3 months, or twice a week if it's 6 months if they're doing IUI or IVF. I talk about that in the IVF video. I talk about that in my last video, so I'm not going to talk about it here. What I want to share with women and men, number one, if you haven't seen the last video, you must watch it. Okay, please watch that. If you want a baby, watch my intimacy and fertility video. That is paramount. I don't care if you're coming in for natural or with Western fertility. You have to follow those protocols. When I'm talking about strengthening your kidney qi, your kidney yin, your kidney yang, your kidney jing qi, among other organ systems, it's because if you can have strong kidney energy internally, your chances of miscarriages goes down dramatically. My miscarriage rate since 2008 has been low. If I don't want to be conservative, maybe 5 at the top of my head. These are women that I helped get pregnant. And if they did have a miscarriage, even then we worked more and they got pregnant and had 1 or more babies. We like to have a 3-year gap from birth to conception. I discussed that privately. When we're doing IUI or IVF, we want to make sure you are ready. We want to make sure you are ready. And I really talked about that in my last video. What I really want to bring home into this video for miscarriage is this is prevalent in society. And I support John Legend and Chrissy Teigen for sharing their most intimate moments, the most vulnerable and most painful moment of their lives, one of the darkest hours of their lives, in the hospital, suffering. Because this does happen. And even though I haven't made a video about it, doesn't mean that I don't deal with this every day. If I were to be conservative, maybe 10 miscarriages in 11 years from 2008 when I reinvented myself to last year. The reason why my miscarriage rate is so low, which I should probably talk about more often, is because I set myself up for success. I set my patients up for success. A system is something that is a repeatable process that you can trust to get the desired results. Now, the reason why I don't have a 100% success rate is there are so many variables. You're not a machine. The Qigong is imperative. The correct number of acupuncture treatments per week is imperative. The Chinese herbs are so important. The mindset is so important. The having sex the proper way, and I'm breaking down this book now, is so important. Yeah, the last video was kind of humorous. It was very informative, but everything in that video was designed so that you watch it with your partner. You have to. And you have to understand that every little piece of advice I give you, especially in Anne's 30 pieces of pieces of advice for fertility, are all given to you on a silver platter so that you strengthen your kidney chi. I say it over and over in my videos. My goal is to not get you pregnant. It's not. My goal is to give you a healthy, happy baby. So then if we reverse engineer that, what is required? What's required is make you totally strong and healthy. Ideal weight if possible. The more you are at an ideal weight, the less pressure it is on your heart, on your organs, the higher the chances are. That's just my opinion. That's my opinion, and I'll have to do more research on that, but this is something that I'm seeing. If we can get you in great shape, if that's possible, to get you to an ideal weight, if that's possible, to get your chi as strong as possible. And that takes time. That takes time. 6 to 12 cycles, 12 to 18 cycles, 2 to 3 years for natural. And we discussed that in private. IVF, IUI, 3 months, 3 times a week, 6 months, twice a week. And I don't deviate from these anymore. I don't, because I'm seeing what happens and I see what is probably not going to happen. I'm going to give a little synopsis. 99 to 2006, my success rate and failure rate were about equal. If not, if I can be honest, a little more on the failure rate, which was painful. That was painful. It was painful to see people lose their money with putting up a second mortgage for their IVF, borrowing money from their parents, borrowing money from their 401k, borrowing money from their credit cards. That was painful to the point where I stopped 2007. And then 2008, I reinvented myself. And I said, okay, if I'm going to take fertility cases again, I want to do this so that I know if I can break this down to a science and I can engineer this correctly in my practice, my success rate can be higher. Because if you come in for pain, I give you a protocol. If you go under once a week, or 2 more times a week. I am a direct student of the late Grand Master, Dr. Richard Tefutan. He was an engineer before he was practicing Chinese medicine. He came from a Chinese medical background from his family in Taiwan. However, his profession forever was going to be as an engineer. So he really taught us how to think like a mechanic, help us really think, what is the problem and what could the potential solution be? And that's how I approach everything now. And it's very ironic to me that the people who brought up John Legend's and Chrissy Teigen's unfortunate miscarriage, and every miscarriage is unfortunate, but this painful, heartbreaking, on the news, all over social media, miscarriage, they were brought up to me by men. Men tend to be solution-based. My practice is solution-based acupuncture. You got neck pain? I'm going to treat it. And not only are we going to see immediate results, hopefully, but have sustained results. So the same thing when it comes to the fertility. I'm not just trying to get you pregnant at the wrong time in your life. I want to get you pregnant when your chi is so powerful that you will have a full-term pregnancy with a healthy, happy baby. They treated me with white gloves when I was pregnant with my 3rd child at 43. I naturally conceived all 3 of them. But I knew, even though I was showing up to my jiu-jitsu and my kickboxing, it's not like I was doing anything hard. Everything I was doing were low kicks and just kind of punching the bag. I was not fighting anyone, and jiu-jitsu was mostly drills. But what I did almost every day with my 2nd and 3rd pregnancies was I treated myself and I did my Qigong. So I just want to wrap that up there, and I just want to make it clear. The more acupuncture, Qigong, and internal work you do, the less chances you'll have of a miscarriage.